So welcome back to our channel. In the previous video, we were discussing about the general pathology. So moving forward, now we have to see here, for example, this is an example that shows here the physiological hypertrophy of the uterus during pregnancy. So in the first image, when you look at this image, the pathologist, he will examine it and he will say that there is actually the small spindle shaped uterine smooth muscle cells that are from the normal uterus, whereas in case of this large plump hypertrophied smooth muscle cells, they are actually from a gravid uterus. So this is actually the normal uterine muscle, and these are actually the hypertrophied uterine muscle cells. So by this way, he can say that this is actually the normal, these are actually the normal cells, and these are actually the abnormal cells. These are actually the hypertrophied cells in which the size has been increased. So they have increase in size. Now looking into the example of the atrophy. So here is the example of the brain. So this is the brain of a normal adult, young adult. This image shows it, whereas in case of this, it shows that this is actually the atrophied brain of 82 years old man, which has actually the atherosclerotic disease. So basically this atrophy of the brain, it is actually due to aging and reduced blood supply. Now, for example, when the loss of brain substance occurs, it actually narrows the gyri and widens the sulci. So here the pathologist, he will actually say that this is the atrophied brain, whereas this is the normal brain. So by this way, we can actually differentiate between the normal phenotype and the abnormal phenotype. Now there is also an example where the cells are replaced by the another type of cells. So here we have these type of cells. For example, these are the normal columnar epithelial cells. So when we look at these cells, so these are the normal columnar epithelial cells, whereas these are actually the squamous epithelial cells. So these cells are basically these type of cells, these are replaced by these type of cells. So in this way, this is actually called as the metaplasia. So this is the metaplasia of the normal columnar cells to squamous epithelial cells in actually in the bronchus. So this also shows that sometimes the cells or some cells are replaced by the another type of cells, and this is known as the metaplasia.